So we'll now move on to Clare Skidmore. Some of you might know Clare through her work with the Housing Lane. Clare is currently the National Housing Lead in the Learning Disability and Autism team at NHS England. And this afternoon, she will help us to explore and bring alive the policy and strategic landscape for us. Over to you, Clare.
Hello, everybody. I'm Clare Skidmore, as has already been said. I'm going to focus on NHS England policy and practice around housing for people with learning disability and autistic people. But I'll make some links to the National Autism Strategy, which is really supportive of what we're trying to do. So just to start off with, so in NHS England, there is, as has been said, a national housing team represented both nationally and regionally. It's a small team. I'm more or less it in the national team, but I work within the strategic commissioning team in the Learning Disability and Autism programme. And so my role is significantly, a part of my role is about influencing NHS England internally, but also influencing and working with people kind of outwardly, so working across government to try to help join up housing policy particularly around people with learning disability and autistic people. But we also have regional teams, which I'll tell you more about in a minute. So the remit is to support all people with learning disability and autistic people, but we do have a particular focus on people who are at high risk of going into hospital, inpatient units, or who need to be discharged from hospital, because there's still more than 2,000 people in that position. So we have the National Housing Programme, which has that remit. Within that, we also have the Capital Programme, which I'll tell you a lot more about in the slides, which is to utilise NHS capital, which can be used to effectively to invest in properties directly supporting the discharge of people from hospital. Next slide, please. So the principle underlying our programme is to help people to find, adapt, or maintain a home which is right for them. And we have a strong commitment to the principle that a true home, if it is designed to meet a person's bespoke needs and requirements, rather than a placement, can provide security and stability and promote people's health and well-being, and play a major role in preventing admission to hospital and really just helping people to have a good level of well-being and health. And we also know from our own assuring transformation data is our data for our programme, and we know from that data that on average, month to month, about 50% of all of the delayed discharges from hospital for autistic people with learning disability are caused by, at least in part, by not having appropriate housing options available. So housing is a really fundamental, which nobody on this call will be surprised to hear, is a really fundamental reason why people often can't leave hospital, but also why people can be a trigger for why people develop a crisis and end up in hospital in the first place, if the place where they're living wasn't right for them. So that's why we work regionally and nationally, and we work very much with commissioners, system leaders, system enablers, people are working across health and social care and housing, to help people who kind of need to make those decisions locally, to understand why housing is important to people's health and well-being, to have good intelligence about people's needs, housing needs and aspirations, to develop those relationships with housing providers across and others, all of the people and people such as yourselves working across local authorities and all kinds of organisations in that place. And I think the move towards integrated care systems is a really important aspect of opportunity. It's a challenge, but it's also an opportunity for us to take that place-based approach and to help people really just fully grasp the way that housing can be accessed, funded and delivered, very much including adaptations, funding for adaptations. Yeah, so next slide, please. So obviously, working for the NHS, the long-term plan is the kind of overall guiding sort of underpinning document that steers what we do, and we always refer everything back to the long-term plan. And although housing isn't strongly mentioned in the long-term plan, it's a key enabler for the objectives that drive our programme. So enabling people with a learning disability and autistic people to live fulfilling lives, to reduce the number of people who are in inpatient settings, and to improve people's health and well-being. And linking across to the National Autism Strategy, shares many of those objectives, and National Autism Strategy has some really helpful specific mentions of housing and of course adaptations, and link very strongly to our own policy in this area, which I'll just come on to. So if you come on to the next slide, please. So the kind of relevant guidance that steers our work at a detailed level in the Learning Disability and Autism programme, and working with colleagues across local government, is Building the Right Home, which was sort of followed on and supported Building the Right Support, which I'm sure you'll be familiar with. That's kind of our guiding document. And when that was published, that came with a £100 million commitment to using NHS England funding for accommodation to fund people's housing. That period is finished, but we still continue to have that commitment to, on average, about £20 million a year. It's not ring fenced; it is prioritised locally, but we strongly encourage people to use it. And we have a network of regional housing leads whose job is, as well as to do all of the kind of influencing, supporting work, to actually practically get those funding applications through. Now, they are made by the housing provider. Applicants can be a local authority provider of housing, a registered housing provider, or a registered charity that provides housing, supported by local commissioners across the NHS and the local authority. And we need to see evidence of all of that. We fund long-term settled accommodation and also short-term crisis accommodation for people of any age, if they have a learning disability, autism, or both. And we do have a strong focus on really trying to prioritise what is a finite resource to try to help people to be discharged from hospital, or to prevent people who are likely to be admitted to hospital. It is provided with a legal charge on the property, which means that it's not really a grant in the traditional sense of the word. It does have to be paid back if the property is sold or no longer used for the intended purpose. But that could be at any point in the future. It's the money's there, or the investment is there, as long as it's needed. We can fund new build schemes, and we do fund new build schemes, developments, but also open market purchases just off the normal property market, or large scale refurbishments of existing properties, as long as the applicant is a housing provider or a charity or a local authority. We can fund 100% of a development. We can also work alongside other funding streams. We do emphasise on the importance of investing in self-contained, small-scale, domestic and feel. That's the kind of mantra of Building the Right Home. We don't want to fund institutions. Even the crisis accommodation should have that domestic feel. And last year, we directly enabled, through our grant, around 83 people to avoid admission to or be discharged from hospital. So it is a relatively small group of people, but it is a really kind of concrete outcome. Next slide, please. So, I mean, clearly, COVID has been hard for many people from a housing point of view, and we're very conscious of the importance of what we're trying to do. And it is it's a really challenging kind of set of issues that we're all having to deal with, everybody on this call as well. And we've noticed that inpatient admissions in our area are slightly rising, particularly the biggest group that's unfortunately growing is autistic young people without a learning disability. We need to understand a lot more about why that is, what we need to do to, I mean, I think we do have some idea about why that is, but I think there's quite a lot of work to do to kind of to tackle that. And there is a significant commitment of investment over the next 3 years for that. 50%, that statistic, that 50% of related discharges are at least partly due to a lack of suitable housing options, is something which I've been really trying to kind of raise the profile of. Even within NHS England, people aren't always aware, and people are quite surprised by that. I'm not surprised by it, but I think lots of my colleagues have been. And that does include people who we know are waiting for home adaptations. So obviously NHS England capital grant is only part of the picture. It's only really for a specific thing. But it is important. We are very much sort of working with systems to help them to use it and to encourage systems that haven't bid for grant previously to do so, especially where there's evidence of need. But also we, as well as all of the kind of day-to-day support work that we're doing with people regionally, locally and nationally, we're also developing a range of support resources, working closely with colleagues in other parts of government for their advice. But so the refreshed NHS England capital guidance, which is obviously quite specific in focus, is almost ready for publication. That's been quite a long time in the making. And hopefully people will find it a little bit more straightforward. And I mean, I think it is still quite a challenging process to go through to get capital grant, but hopefully it'll be we have taken out some of the hoops, so hopefully it'll be a bit easier. Also, the housing how-to guide is something that is being developed led by Learning Disability England, working with the Housing LIN, and that is a resource that is aimed at people and families around navigating their way through what do you do, where do you start, if you need to find a good housing option for yourself or your family member, but also aimed at commissioners and system leads who often have some of the same questions. And the housing design guide, which is something we're currently scoping with a view to commissioning. I said later this year, I actually really mean next year. And I think hopefully this audience, I'll be quite interested to talk to about your views on what would be useful around that, particularly obviously thinking about autistic people with a learning disability. And I've got one more slide, but I suppose my final message really on this slide is just I'm always really keen to hear about people's experiences of kind of particularly obviously on this call around how straightforward or challenging it is to secure disabled facilities grant, other sources of funding, and just finding a way through the system, and how NHS England and NHS in the regions and locally could perhaps help more around joining things up, and whether there's kind of areas that our team might be able to prioritise in future years that might be supportive. So I think just to go to this final slide then, this is us, this is the National Housing team, and those email addresses hopefully can be shared through the slides. It's also on our website. So you're very welcome to get in touch with either me or your regional lead, which you can see there, if you have any questions or suggestions. Thank you.
Thank you, Claire. I don't think there's any specific questions that have come up. I've got a particular question, and it may be that you can't answer this, but in terms of obviously the impact of COVID, the various policies such as discharge to assess, the urgent care response models, but particularly around discharge to assess and discharge destinations, are you collecting any kind of evidence around whether people are being discharged or that people are being discharged to the right in terms of the different pathways on the discharge to assess, that we are getting that right for people with challenging behaviour, and that people are perhaps being discharged to perhaps long-term care that could actually be managed if there was more time spent in terms of that discharge planning or assessment? I don't know if that makes sense.
That's a good question. I think actually, when it comes to people who happen to have a learning disability or are autistic, but who are in hospital for other reasons, whatever reason, I'm not sure actually what the kind of evidence of outcomes are in terms of discharge to assess process, and that's something I'll go away and it's a question I should know the answer to, so I'm going to go away and find out more about that. I'm much more in touch with the experiences of people who are in sort of mental health units, who are in inpatient units, and that we actually we know that what we're doing at the moment is we're taking another look at all of our data, all of the Assuring Transformation data, and trying to match that with what data regional housing leads have in regions about where people are going, what's happening to people. And there isn't enough data about where people are going to. What we do know from the Assuring Transformation data is who is delayed due to housing, due to lack of housing. And we also know where people have a discharge plan, date, whether the planning for people's accommodation has been started or not. And we have some concerns from data that in some localities, people are starting to plan for their accommodation rather late. And that is obviously something which nobody will be surprised by, and I think does reflect some of the experiences in the kind of mainstream health system as well, that kind of in all kinds of areas. So I think we do know that, but I think anecdotally it does vary hugely as to whether commissioners are enabling people to move into housing solutions or whether they're just finding a bed. And that's not meant critically. It's I think that's the culture change that we're trying to talk about all the time, is to think early, think housing, and not just to kind of focus on finding another bed.
And to plan ahead into it. Tony's asked a question. I don't know if you can answer this. His question is, can we apply to the NHSE capital grant to pay for any outstanding balance on a DFG on a DFG such an extension?
In most cases, I would say probably not, because it depends on who the applicant is, because the applicant does need to be a housing provider, a registered housing provider, or a local authority, or a charity. So so individuals can't apply for capital grant. It does depend on who the applicant is, and also we do, because we have this legal charge on the property. That does create a challenge for some providers who are unwilling to have that legal charge placed on the property.
Okay, cool.